Hey, this is Dr. Ty from Premier Orthodontics, and in this video we're going to be going over a patient who had a severe deep bite. We're going to show his before and afters, but before we get started, if you haven't yet, make sure to like and subscribe to the channel. And if you live in the Arizona, Phoenix area, we do offer free consultations as well. Here's our patient here. He is a young adult. He's in his early 20s, and you can see he has what we call a severe deep bite. The top teeth completely overlap the bottom teeth, and he's essentially biting right on top of the lower gums. He's not even biting onto the teeth. You can see the front teeth are very kind of what we call retroclined, where they're tipped back, and that's due to really strong lip muscles. So the teeth will move based on the forces around them. So if you have really strong cheek muscles or lip muscles, those will actually put forces and push the teeth back. So that's what causes deep bites like this. Also, it's really strong jaw muscles. Having really strong biting forces tends to intrude the teeth, causing more of a deep bite. So these cases do have some challenges in that we need to open the bite, and we're fighting against all of those muscles. And so there's some things that we'll do to consider with that. So one thing to note is in severe deep bite cases like this, they will actually bite on the gums, and over time they will cause gum recession as well. So you can see he's just got the early signs of it right now, but that front tooth where he's hitting pretty hard with his teeth has already started to show some signs of gum recession. That's just due to biting on that area over and over. That force of the bite, as well as any food that gets kind of packed down in there, is not a healthy thing. So this is definitely something that aesthetically we're going to make look better, but long-term health-wise of his teeth, it's going to be a much healthier position as well. Older adults who come in with similar type of bites, usually they'll have much more severe recession, and it's something that's more serious. So luckily, this young man's pretty early. He's in his early 20s. We can get this fixed, and he doesn't have any long-term issues, most likely. Whenever we fix really severe deep bites, usually there is a really big, what we call overbite or overjet hiding. So meaning that as soon as we put braces on and kind of open up the bite, they'll end up having really flared or proclined teeth as well. This video helps to demonstrate why that is. So again, once we kind of overpower the lips and the bite, you can see that once we're done, these teeth are going to be sticking out quite a bit. And that's just because the teeth have kind of got pushed back. So whenever we have bites like this, we have to decide after we fix the deep bite, how are we going to then fix the overjet and help that bite get fully corrected. So those are the things that we're going to consider. So treatment options. Number one is we will use braces plus bite turbos or bite pads to help open the bite. So we've had other videos all about how to fix deep bites. You can check them out. We'll link them in the description below. But that's usually step one, is we will fix the deep bite. We get the bite opened up, get that fixed, and then after that we have to decide how are we going to fix the overjet or the overbite where the front teeth stick out too far. And so there are a few options for that. One is elastics. That's a really good option if they will be compliant. Another is forces springs. That's an option that we'll consider sometimes. And last is extractions. If there is a severe overjet after we fix the deep bite, that is something we'll consider as well. So generally speaking, for me, I like to get the deep bite fixed first, have the patient start rubber bands, and then about a year into the process we see where we're at and decide if rubber bands are going to be enough, but leave the option open that we may need to do forces springs, or we may even need to do extractions if the severity of the overbite's large enough. So here's our patient when we start. You can see he's got that very deep bite. You can just imagine if we open this up, these teeth are going to come forward, causing an overbite or have excess overjet. And you can see the gum recession there as well. So here is what a bite pad looks like. It is basically a little blue kind of a stop that they bite on. It kind of feels like you're biting on marbles when it's there. But it props your bite open, and it allows these back teeth to drift together. So this is what I'll do in more of the mild or moderate deep bites. In more severe deep bites, we will go with more of a bite turbo. And this is what it looks like. It goes right behind the front teeth. And so we'll place this bite turbo. The ones we use generally are clear. They do come in metal as well. But these go behind the front teeth. And you can see the back teeth are completely separated. And since the back teeth are separated, over time they're going to drift together. Usually we'll put some rubber bands in the back as well to help pull those teeth together while we have these turbos in place. And over time, the idea is the front teeth stay in that position, the back teeth drift together. We can get the bite opened up that way. So for this patient, we started off with bite pads. We switched to bite turbos as well, I believe. And he had a pretty severe deep bite, so many times we'll actually do both of those options as we're getting the bite opened. And then this is what forces springs or class 2 elastics look like. They both basically do the same thing. They try to pull the top teeth back and push the bottom teeth forward. It can be done with either this elastic or this spring device. If a patient is really compliant with elastics, a lot of times that's enough to get the bite corrected. If we need some extra help, if we have a non-compliant patient, or if it's a really severe overbite, sometimes that's when the spring is needed. So again, for this patient, I said, let's get your deep bite correction started. And while we're doing that, we're going to have you wear rubber bands for that year, because that helps with the deep bite correction anyway. And then kind of see where we're at after that. So here's our patient. And here is this patient when he's all finished up. You can see, we can now see those lower front teeth. The overbite is corrected. You can tell that he probably didn't have the greatest hygiene when he was in treatment. So this is kind of a note that if you're in braces, make sure to brush and floss really, really well. Go see your dentist, and you can avoid your gums looking like this once you're done. The good news is, give him probably 2 or 3 months, his gums are going to look much better. But this is often what it looks like right when we get the braces off and we have some kind of unhappy, unhealthy gums. So here are some before and afters. You can see just how much deep bite correction we were able to get. Before, he was biting on top of the gums. Now we can finally see those lower front teeth. You can see this was the tooth that had that severe gum recession. You can see it actually is looking much better now. Again, after the gums puffiness kind of goes down, we'll probably reevaluate that as well. And then the bite on the side, you can see all these teeth were trapped up underneath here, and we were able to push them all the way down and get it to where we can finally see those lower front teeth. He's not going to put extra pressure on the tooth or the gums in front. This is a much more aesthetic as well as much healthier position as well. So that is how we fix severe deep bites. All these kind of cases will be a little bit different one to the next depending on the age of the patient, the compliance, how cooperative they are, as well as how severe the deep bite is. So this is one way that we do it. If you have a deep bite and you go to an orthodontist, they may have different ways to do it. There are lots of different methods. Most of them work, and each one is kind of dependent on the doctor as well as the patient on which one they think works best. So if you have any questions about deep bite treatment, you can ask them in the comment section below. If you haven't yet, make sure to like and subscribe to the channel. That helps us out. And if you live in the Phoenix, Arizona area, we do offer free consultations for braces or Invisalign. You can check us out. There's a link in the description below. Thank you so much, and we'll talk to you soon.